Welcome to the live streaming. I'm how to educate the mic. All right. Sorry, we are seeing the weather in this way, but we are going to stream today um to make sure that we keep up the good work always. I'm how to educate the mic. As you all know, this is Healthy Living Global, and this is a channel where we share live informations. All right, on this live streaming. All right, so there's a lot of things that concerns us that we are expected to know. So um, that is the reason we are making this live streaming every day to see that we improve our health. Right, that's what we do on this channel. This is Healthy Living Global, and this channel supports health promotion, disease prevention, rehabilitation strategies. We make effort to see that you all stay on the know in improving your health. So these are a goal of which each and every one of us is expected to do that goal of improving your health, right? If you are joining us for the first time, do well to subscribe to our YouTube channel and also turn on your notifications so that you will see what we do on this channel. All right. It will go a long way in helping you to remain active and also know one or two things you are expected to know as far as um, this channel is concerned. Open this down. All right, so we have discussed a lot of things. For those that have been with us on this channel, we have discussed a lot of things. All right, on this channel, we've discussed many things on this channel. All right, that um, in fact, if we start counting it, a lot of things, all right? Both even we have done that of infertility in male, infertility in female, many non-communicable diseases, right? Chronic ones and so on. Because a lot of things, all right. If you want to see our live streaming videos, you can go and check up on them. We have a lot. Recently, we're discussing about structural defect causes and prevention. Of course, we we have discussed this to an extent, though I wouldn't want to continue on that discussion due to the fact that we are lacking some of the teaching aids that we need, right, to facilitate it. All right, is expected to be more practical instead of theoretical. All right, so if we say someone is having anencephaly, you are expected to be seeing it. If you say that someone is having spinal bifida, you need to see it. All right, you're having cleft palate, cleft lip, and so on, lordosis, scoliosis, kyphosis. You understand? The descriptions may not be real, all right, as when you are seeing it with your eye, visual um, um, explanation, right? You are going to see everything that is there. So, we have discussed a lot of things, right, on this channel, and we keep discussing many things on this channel. But on in today's live streaming, I want us to make something here remarkable. Even though we have discussed other things that are related to it before now, but we need to get this thing very clear and direct. All right. Now, we have been hearing of acid reflux. We have been hearing of ulcer. All right, a lot of people get this twisted. A lot of people misunderstand the two. All right, some people may have all the chest pain. All right, a very um serious chest pain. All right, they don't even know if it's a result of any cardiovascular issue or it's because of acid reflux, or they don't even know. Some will even say it's ulcer, right? So we want to establish the difference between this acid reflux and ulcer. They are not the same thing. You understand? They are not the same thing. Of course, sometimes the cost may be different, right? The cost may be different, right? At some point, or which I'm going to explain everything um, on this live streaming, all right, so that we all become aware of what the two is all about, then know the treatment approach. Of course, the treatment approach are not the same, right? If you are treating acid reflux, you should know what you are going to use, and if you are treating ulcer, and depending on what the cost is, then you should know what you are expected to do. All right, so if you did not do the needful, um you see that you may end up maybe abusing antibiotics and also bringing more complications to your health, all right, instead of going for the best strategy ever. Now, what is acid reflux? Acid reflux happens just as the name sounds, reflux. Reflux is just like regurgitation or uh, going backward of a particular substance. Acid reflux is a condition in which the acid in the stomach goes back to the esophagus. What causes that is because of what the lining that is separating the esophagus and the stomach, all right? There's something that separate the two of them, which we call LES, all right, that separates the two, all right, is not properly closed. When you take in food, it will go into the stomach, all right? When it goes into the stomach, or as it is going into the stomach, it will put the LES, all right? Then the food will enter the stomach, then it will still close back. But in this acid reflux, that LES is not properly closed, leading to what? Reflux of acid, right, back into the esophagus. And then a lot of things that could make it to be worse, all right? Even though the major cause of it is high stomach acid, all right? But there's many things that could make it to be worse. Maybe it could be um, large meal, all right? Eating excessive meal, or you are lying down, all right? You lie down and you put your head in this way, all right? Let's say your head is becoming low. Instead of, if the proper way to lie down is to put a pillow, all right, at the back of your head, so that you feel comfortable, at least you'll be a bit raised. But some people will not put that pillow, they'll just lie down. Before you know, there can be opening of that LES, and before you know, um acid can go back to the esophagus, which is what gives that burning in the heart. Sometimes I'll ask people, do you have ulcer? And some people say, yeah, I think I have ulcer, because I always have this burning within my heart and even goes to the back. That may be acid reflux, it may not be ulcer. And I'm still going to explain ulcer for you. Now, anyone that you see the pain at the chest region, right, at the chest region, most of the time is acid reflux. But take note of this: acid reflux also can become can a kind of develop and result to ulcer, all right? Ulcer at the esophagus. Please take note. There can be ulcer, which is duodenal ulcer, gastric ulcer, right? Gastric ulcer in the stomach, duodenal ulcer in the duodenum, and there can still be ulcer in the esophagus. All right, there are two different things there. But what gives that heartburn mostly is what? Acid reflux. Sometimes it may have not resulted to that development of ulcer in the esophagus. And what is ulcer in the first place? Ulcer is just development of wound, all right? When there is wound in a particular region, that's what we term as ulcer. Someone can have leg ulcer, hand ulcer, and different type of ulcer, right? So we want to establish this difference so that we get this, even though, just like I said, we have discussed a lot of things related to this, but let us get these things straight. Let us get this straight, right? So we all know the causes of ulcer, just like I explained in a live stream that I've done before now, that the two major causes of ulcer is high stomach acid and H. pylori, right? That is, by the way. Now, what we are trying to establish today is the difference between acid reflux and this duodenal ulcer or gastric ulcer. Now, if you eat large meal, it can result to this acid reflux. If you are someone that is sleeping, maybe after you are done eating, you just lie down immediately, it can still result to this acid reflux. Acid can go back to the esophagus. If you are somebody that is eating fatty food or a lot of spicy food, it can still do the same thing, result to this acid reflux. All right, so depending on your habit. Now let's discuss that of ulcer before we talk about the treatment strategies. Now, that of ulcer, which is gastric ulcer, duodenal ulcer, peptic ulcer, anyone you call it, all right, what happens in that place is that what there is high stomach acid, all right, which may a kind of bore the intestinal wall or open it up, all right, eat it up, the intestinal wall, and result to that ulcer. And it can be a bacteria which we call Helicobacter pylori, right? H. pylori. So now that particular H. pylori can still eat up that stomach wall, and high stomach acid can eat up the stomach wall. And before you know it, will result to ulcer. Right, so which is to say that if you are someone that is taking still fatty food, excessive intake of food, all right, at a time, or you are some of time 6 to 6, you are doing it for 3 months or more, you are at a very high risk, because at that particular point you are fasting. That is the point of which the stomach acid can increase, all right, and anything can happen. And also even the diet you are taking, all right, is part of the cause, because of that's where the H. pylori comes. So anything you need to take in needs to be hygienic, right, in order to overcome this ulcer of a thing. So now, if we are talking about ulcer now, just like I've mentioned the causes, all right, can be caused by H. pylori, and it can be caused by high stomach acid, and many things can make it to be worse, like taking of non-steroidal anti-inflammatory drug, which we see that it blocks the prostaglandins, and prostaglandins is what clothes or coats the intestinal wall, so that stomach acid won't get to it. All right, so now if the stomach wall is deprived of that prostaglandins, before you know it, it can develop the ulcer, so it can trigger it up. Now, excessive meal can trigger it up. Taking a lot of spices, fatty food can trigger it up. Excessive fasting can trigger it up, and so on and so forth. So please, let's take note of this. Those are the causes. Now, if you want to all right, so just like the same way that the treatment approach of H. pylori, of stomach, gastric, or duodenal ulcer is different from the high stomach acid as a cause of ulcer. All right, if you are treating it, is a different thing. All right, if you are treating that of H. pylori, you are going to use antibiotics, which we are aware of that is a bacterial infection. And if you are treating high stomach acid, you are going to use antacid and stomach protecting medicine like omeprazole, esomeprazole, rabeprazole, pansoprazole. There are many of them, right? So you talk with your healthcare provider to prescribe the exact one you are going to need for your treatment, right? This is for educational purpose. Now, what about that of acid reflux? Acid reflux, the only thing you need to be doing is to make sure that what you take the necessary steps to reduce what is triggering it up, right? Which is, when you are done eating, do not lie down immediately. It is very dangerous, right? If you are done eating, you sit. It's either you sit down or you can move around, all right? Moving around after taking your food is not like the old idea that we have about meal. They will say, sit down now so that your food will digest first, and so on. Yeah, Sitting down is fine, lying down is not fine, and moving around is better for those that are having diabetes, all right, especially if you take something that contains carbs. For those that are having diabetes, moving around, all right, when they are done, they just walk around the room is better for them. Why? Because at that point, when the high the there will be a lot of glucose, all right, in the blood as a result of the carbs consumed, all right. The body, the muscle will now, through that physical activity, moving around, the body will take up the glucose, right, making sure that what there no spike of sugar level, all right. That is what happens at that point. Now, if you want to prevent or even treat anything acid reflux, you can use some antacid, all right, to handle it. You can reduce spices, fatty food. All those things um, can even weaken the LES, making it impossible or causing problem with the covering of the LES. There's something we need to mention here also, which is very important and regard this acid reflux. We have consumption of alcohol and even smoking, right? Consumption of alcohol. If you are someone that is taking a lot of alcohol, you are going to be experiencing this acid reflux, all right, from time to time, which will be very dangerous, all right. So you need to just do the needful. And one remarkable thing about this acid reflux is sour taste. One of the remarkable symptom or sign of this acid reflux is sour taste. Before you know, you begin to, aside the heartburn, all right, you are going to be noticing sour taste. You are going to notice something. No, you're just like, how acid, when the is this is just a characteristic of acid, all right. If you want to only characterize, one of them is for sour taste. So if it goes back, acid reflux, if it goes back through that reflux back to the mouth, all right, you are going to feel the taste, all right, on your mouth. You go back through the pharynx, come back to your mouth, all right. You are going to feel that acid taste, all right, on your mouth, which we say that what is sour taste. Sour taste is one of the remarkable sign to show that you are having acid reflux, and also heartburn and so on. So now, the treatment approach, I said that what you need to actually do not take large meal at a time. And if you are done eating, do not lie down immediately, right? For those that are eating late night, do not lie down immediately. If possible, if you're having high sugar level, you move around. And also, if possible, do not take large meal at night. I know the reason why I'm putting it in, if possible, all right, because I know the nature of the country we are in, Nigeria, and different at most 7 p.m. You should end what, 6 p.m. or at most 7 p.m. So, and if you are taking anything again, even that is that late hour, make sure you don't consume large meal. And if you are consuming any little meal, just try to move around, especially if some that have carbs, so that the body will make use of it, or just do a little bit of exercise. Let the body just make use of it. If failure to do that, is going to cause a lot of complications in the body. So now, after you are done eating, you lie down. You don't lie down, right? Sit down or move around. That is strategy now to treat do not take food that have fat, all right, a lot of fatty food and even spices, all right, and reduce the intake of even non-steroidal anti-inflammatory drug, just like you do with ulcer, all right. Reduce the intake of that. And also, you try as much as possible to take an antacid. If anything like that comes in, all right, take antacid. It's going to solve your problem, instead of you um going for any antibiotics, all right. For acid reflux, antibiotics is not the cure, all right. But for that of ulcer, what you need to do for that of ulcer, you need to check what exactly is the cause of this ulcer. Now, is it a result of high stomach acid, or is it a result of H. pylori? Now, if it's a result of high stomach acid and it have not caused a wound on your duodenum or your stomach, what you should just do is just to use stomach protecting medicines or antacids. All right, that's what you are going to use. But if you discover that you have um, developed a wound there, and what will show that a wound have been developed is whenever you eat, you begin to notice that stomach upset. Sometimes you go to toilet, you see stool that are dark, all right, like a tar, all right. Sometimes you vomit with blood and so on. All those signs will show you that what the ulcer have developed already. So if you're a result of high stomach acid and have developed a wound, you can still go with um, medicine that protect the stomach, medicine that reduce stomach acid, and also you go with antibiotics that will heal that particular wound. And if it's caused by H. pylori, you know that your treatment is direct, all right? You are going to treat the H. pylori at once to make sure that what you overcome this ulcer. Of course, if you are not aware, ulcer can cause anemia. Ulcer can cause shortage of blood. If you see someone look as in just emaciate, become thinner, all right, within shortest possible time, the person may need to be investigated. And if there is a report of this star color of stool, all right, looking black or vomiting with blood and so on, a lot of tests can be carried out. It may be a stomach ulcer, which can be treated and everything will be resolved. Failure to do that, you begin to notice a lot of symptoms, all right, like that you are going to notice a lot of symptoms which will still bring about the anemia. So please let us do the needful. I believe we have been able to differentiate between these acids and reflux. They are not the same, they cannot be the same. The treatment approach is different. I'm going to attend to it. I'm going to attend to any question. Put in the comment section and I will attend to it as soon as possible. See you guys tomorrow in a live streaming on this channel. I believe we are going to get there, all right? So invite your friends, invite your loved ones, let them come and be part of this live streaming, and we'll move it to the permanent side. I believe tomorrow is going to be a brighter day. We have bad weather somehow, so but we're going to get it right. So thank you for being part of us today. All right. So if you have any questions, just like I've mentioned, just put it on the comment section, and I'm going to attend to it once I see notification. See you guys tomorrow by 10 a.m. on this channel.